Another type of device that we use to maintain hemostasis on patients who come out of the cath lab is we use a radial management system, a hemostatic device. So I'll just come up close so you can see this. This is a clear plastic band, similar to my Fitbit, that just goes around the wrist and is secured by Velcro. This band is typically applied in the cath lab. It doesn't matter which direction when the patient comes to you. If the tubing is facing up or facing downward, it does not matter. What you need to know is that it is applied in the cath lab with a predetermined amount of air injected into the band. So what they do, this is applied because you want to prevent bleeding of that site, and this is a great way to maintain pressure on it. So according to your hospital protocol, what you need to do is when they come out of the cath lab, you need to remove pressure from this device at predetermined times. So this catheter here, this syringe, is proprietary to this type of device, and it will be available at the session if you want to see it. You can expand the plunger to inject any amount of air, but when you want to release, it will only release 2 cc's of air at a time. That way we will avoid removing this device and removing all of the pressure at any time. So perhaps your policy says release 2 cc's of air every 15 minutes, every 20 minutes. When you just twist that, I don't know if you saw how quickly it releases that oxygen or the air into the syringe. So I twist it again, it removes 2 cc's of air. Again, follow your protocol to remove 2 cc's of air with this particular device, and you're always checking underneath that the patient has no rebleed. If the patient does rebleed, for example, if we release 2 cc's of air 3 times and they're continuing to rebleed, we draw up 6 cc's of air, re-inject 6 cc's, follow your protocol to begin deflating the band again. What we're always looking for is when this is completely deflated, we need to remove this device. So we don't just take it off and pull it off because the clot has developed there and we don't want to remove the clot and have bleeding reoccur. So sometimes when we're removing it, be careful. You need to twist it carefully, remove it, and you can apply a Band-Aid over the site. Instructions for the patient should be to avoid severe wrist flexion extension, and they can resume normal activity according to your hospital protocol after the band has been released.